Hello, everyone. This is Michael from Blue Sky Bio. I would like to welcome everybody who's joining us for today's webinar presentation. We are continuing with our ongoing webinar 2021 series. You could stay up to date with upcoming sessions as well as view recordings of past sessions on our website, blueskyplan.com/webinars 2021. And on our Facebook group, Blue Sky Bio group on Facebook, you go ahead and stay up to date with upcoming sessions. I'm sure most people who are attending this presentation are familiar with our orthodontics module. Blue Sky Bio started originally first and foremost with our surgical guide module, but over the years we've developed additional modules, including our orthodontics module, which now is robust, includes a lot of different type of automation. For example, automatic model cleanup, automatic button placement is being released soon. Advanced features and capabilities, including automatic trimming of aligners, in-software aligner design, different options for creating and planning IBTs, and much more. So if you haven't yet tried it out, of course, you could download the software for free from blueskybio.com, install and try out our orthodontics module. Today, we have the privilege of hearing from Dr. Melissa Shotell on the topic of growing your practice with clear aligners and Blue Sky Bio. Dr. Shotell is an orthodontist that focuses heavily on education and training and consulting. She lectures and presents regularly on the topics of dental technology, clear aligner therapy, orthodontics, in-office clear aligners, office efficiency, workflow, teamwork, and many other topics. She shares tips and tricks in orthodontics and clear aligners on social media under the tag or name Aligner B. Dr. Shotell.
Hi, Michael. Thank you so much. It's a pleasure to be here this morning with everyone. Happy Sunday morning. It is quite early here on the West Coast. So I'm very impressed that so many of you are up on Sunday morning to share your morning with me to talk about one of my absolute favorite topics of clear aligners. So let's go ahead and get started.
Okay, you could share your screen.
Perfect. Can you see my screen?
Yep, good to go.
Marvelous. Well, thank you so much for that wonderful introduction, Michael. For those of you who are curious, a little bit of information about me. I was a general dentist for 4 years, working in general practice until I went back to school and did my orthodontics residency at Loma Linda. So I'm going to assume that many of you today that are here participating are general dentists looking for ways to expand your practice and your use of 3D printing in office. So I have been exactly where you are. I was in general practice, and now I am an orthodontist and a diplomat of the American Board of Orthodontics. However, I absolutely love restorative dentistry, and I practice in a combined orthodontics, prosthodontics private practice. And I see every day the benefit of how we can combine clear aligner therapy and orthodontics to improve our restorative and clinical outcomes for patients. So this is a real passion for me with clear aligner therapy. And this is something that fits in so beautifully into the restorative and general practice. So I'd like to thank Blue Sky Bio for inviting me to give this presentation. I know many of you are most likely already using Blue Sky Plan for surgical guides and for other restorative purposes. And for those of you that have begun using the orthodontics modules, that is fantastic. Let's see today how we can explore how to really expand your practice into in-office clear aligners. So thank you so much to Blue Sky Bio for hosting this presentation. Let's definitely connect and exchange thoughts and ideas. As Michael said, I share tips and tricks on Facebook and Instagram as Aligner Bee. My name means honeybee in Greek, so Aligner Bee is easier to remember than my full name. For those of you that really want to get involved and deepen the conversation, I do run the Facebook group of in-office clear aligners, where you're welcome to post questions, share cases, and really ask questions of a large group of doctors that are currently working with in-office clear aligners. I'm also on Instagram, and my website is Learn Dentistry. For those of you after today that are really ready to dive in and want more formal instruction on this topic, I do have a in-office clear aligners course that is 33 hours in length. It explores everything from diagnosis and treatment planning with clear aligners, working with an aligner laboratory, and all of the steps and fabrication for in-office clear aligners. For those of you that are participating in today's webinar, I would like to offer you $50 off of the online course. And that would be with the coupon code shown here for BSB Web 2021. So definitely, if you're looking for more instruction, please make sure that you use the coupon code to take $50 off the online course. So today we're going to answer lots of questions, but I'm sure we'll also raise a few more questions. So I'm going to save time at the end of the presentation today to answer those questions. I'll also be happy to answer them online, either on my Facebook page or in my form. So today, let's take a look at why we want to use in-office aligners. We're going to take a look at the in-office aligner workflow. We'll see how to utilize Blue Sky Plan to facilitate our orthodontic treatment plans and creating our in-office clear aligners. And we're going to look at the advantages that we have with bringing Blue Sky Bio into our practice. So looking back historically, clear aligners actually began as an in-office process. I know most of us that are in practice now are used to seeing major aligner laboratories that create clear aligners, that create the treatment setup and fabricate the aligners for us. However, this is really where in office is where clear aligners truly began. And I had the privilege of studying at Loma Linda under Dr. Nahom. I met him when he was in his 90s. And I heard his stories of how he pioneered some of the development of clear aligner therapy and removable appliances in orthodontics. At the time when these were first developed, vacuum formers did not exist. So he would take a plaster cast, he would section the teeth and reset them in wax. He would take a pickup impression if needed, and then he had fabricated his own vacuum forming apparatus utilizing a steel drum, a vacuum cleaner, and an iron to heat the plastic material that he had acquired from a dry cleaner. So really a very involved process that developed in the 60s. And it continued this way for many years, even after the implementation of vacuum formers. For years, doctors wanting to perform clear aligners had to section the models and reset the teeth. I can say that I have had to go through this exercise in residency, and it's something that I wouldn't want to return to. However, I find it amazing that a process that started in office, then went predominantly to mass scale laboratories, has come back to us now in an in-office process that we can control. It's much more high tech now, starting with an intraoral scan, but we can take our in-office intraoral scan and go through the entire laboratory process in our own office to create clear aligners for our patients. So looking at the historical perspective, what began in office with resetting plaster models, then evolved a little bit further. With the invention of the Essex system, we developed pliers that could be heated and could be used to alter and adjust individual aligners, or composite could be placed on teeth to create a pressure point with a clear aligner. However, the patient had to be seen frequently and periodically so that adjustments could be made to each and every aligner, and the aligners had to constantly be remade, taking new impressions as the teeth moved. We've seen the development of mass customization of clear aligners, and the first clear aligner laboratory was Invisalign from Align Technology, and this really mass automated the process. So when we look back at the historical perspective and we see where clear aligners began in office, how we've gone through developing more advanced techniques and moving into mass customization, we can see how we can take ideas from each of these developments and from all of the progress that we've made with clear aligner therapy, and how we can work to begin to bring this process in-house into our own offices, utilizing software through Blue Sky Plan, our 3D printing technology, vacuum forming, and trimming. So, why in-office clear aligners? Why would we want to expand and move away from a mass aligner laboratory into bringing this process in-house to create clear aligners for our patients? And for me, this process began because I wanted to have complete control of my cases. I often found that I was getting good results with custom commercial aligner laboratories. However, I found that there was always something missing. I always wanted one additional refinement. I always wanted to create a handful of more aligners, or I was looking for a faster process for my patients. So my movement towards in-office clear aligners in my practice began for the desire to have complete control of the entire process. I wanted control to begin with my case selection and selecting those patients that would be a good candidate for clear aligners and for in-office fabricated aligners. I wanted to be able to control my treatment setup so that I would have to create only one setup and not communicate back and forth with a technician. I wanted to be able to control the design of my aligners, choosing my materials and the trim line, which both have a significant impact on the mechanical forces of the clear aligner. I wanted to be able to control the fabrication process, to control the details of the aligners. And I also wanted control of branding within my office and within my practice. So this is what led me to looking for all of my in-office clear aligner options. Now, many of the advantages that extend beyond having complete control of our cases and by being able to utilize this in-office workflow and process. Some of these advantages include same day or next day. We're living in a society where patients want things now. Patients don't want to wait for anything. When I take a patient's intraoral scan, they literally want to know how fast they can get their clear aligners. And for most patients, orthodontics is a very emotional purchase. By the time they have found their way to the orthodontics office or to the dental office, the patient is really already committed to treatment. They're excited, they want to get started. They don't want to hear that they're going to have to wait 2, 4, or 6 weeks to get their clear aligners from a laboratory. So one of the big advantages that I've utilized in-office clear aligners for is that wow factor for my patients. If I have a patient that wants to get started right away, maybe they have a family reunion coming up or a wedding, although COVID has delayed many of these events, we can let them know that we can help them get to their goals for treatment completion by getting them started right away. Often if a patient comes in the morning, we can create one aligner and have it ready for delivery by 5 o'clock that day. Or if a patient comes in later in the day, we can try to have it ready for the next day. And for patients, this creates a real wow factor. This creates more investment for them into the treatment process because they see how efficient your office is. So for patients that are in this, I want everything now kind of mentality, they have been sitting at home bored through the COVID-19 shutdowns. They're ready to get out again. They've been looking at their teeth on Zoom. They want to get started right away when they come in for treatment. So having in-office clear aligners as an option for your patients will really facilitate more clear aligner cases and starts when you let the patient know that you can get started right now. Among the other advantages of bringing the process in-house for in-office clear aligners is the savings. Not only are you going to save the time that we just discussed of not waiting for your aligners to return from a major aligner laboratory, but also the financial savings and cost savings that you'll have on the lab bills. And I'll break this down later utilizing Blue Sky Plan and the materials in my office to show you the cost savings and the advantage. So I look at it that we're saving both time and money for both the patients and the practice. But one of the other huge draws for me into in-office clear aligners, when we translate that financial savings of bringing the process in-house, is this really gives us the ability to compete with the direct-to-consumer movement. Many patients are becoming more aware that taking aligner impressions at home does not always result in the results that they're looking for. And I actually get a lot of patients in my practice that have tried the home options and the direct-to-consumer options for clear aligners. So many patients are aware that involving a doctor in the process is an important and critical factor. And by utilizing the cost savings of in-office clear aligners, we can try to lower our fees for our aligner therapy in our practices and really compete with these direct-to-consumer options. Many of the direct-to-consumer options are really limited to very small treatments. And we can see with the cost breakdown in just a few minutes that if we have a patient that is going to be in a short treatment of maybe 6 to 12 months, how we can translate the savings of our in-office clear aligners into a highly competitive price point for in-office clear aligners within our practice. Now, one of the things that we do have to look at in the considerations when we look at creating the workflow in our practice for in-office clear aligners is how the workflow is going to vary from what we are used to with our conventional workflow versus bringing this process in-house. If we look at our conventional aligner workflow, we see where we will identify a patient within our practice. We may take their records either at a hygiene visit or at their initial appointment, or when they come in for their orthodontics consultation. Traditionally, we would then take those records and we would submit a prescription to our aligner laboratory, and we would wait for the treatment setup to be sent to us. Once the treatment setup is sent to us, we would look to see if we want to revise that setup or if we are going to approve it from the setup that the technician has created. Now, what we don't see here in this workflow is it really doesn't do this process justice, because here I have reviewing the treatment setup is just one step. I have to say that traditionally, I have to have it in general 2 to 3 revisions with most aligner laboratories before I've achieved the treatment setup that I'm looking for. So it can be a very time-involved process, taking up to a week of coming to that final treatment setup that we're ready to approve. Once the treatment setup has been approved, we then have to wait for the aligners to be fabricated and shipped to our office. So looking at our conventional aligner workflow, when we compare that to our in-office aligner workflow, we can see how we can save time and take more control of this process. In our in-office aligner workflow, we're going to identify our patient in the same way, seeing if they're a candidate for aligner treatment. And we're going to take our records. And this is where the difference begins. Instead of sending our records off to a major aligner or laboratory, we can create the design in our own office utilizing Blue Sky Plan. If you're not ready to take a step into designing your own clear aligners, we can have Michael speak at the end about some of the services through Lab Pronto and Blue Sky Bio. There are the services available to have that setup created for you. I myself personally like to set up all of my own aligner cases. I describe this to my patients as playing high-tech Tetris. So I realize now that I'm a little bit older than I was when I started using that analogy, because years ago, many of my patients knew what Tetris was. Today, I'm afraid to say that only about half of my patients know what Tetris is. But for me, this is sitting down at the end of the day at my computer and seeing how we can fit all of the teeth together. Once our design has been created in our office, we can choose to do in-office production of our clear aligners. utilizing our 3D printers, our vacuum formers, and trimming. Or we can choose to outsource aligner fabrication to a laboratory like Lab Pronto. And we can chat a little bit about this in the end during the question and answer session. So as you can see, there are many different avenues that can be taken in the in-office clear aligner workflow. We have the ability to control the design process. We have the ability to control our in-office aligner fabrication and the design of our clear aligners. Now, one of the points that's very critical to this that I do recommend you take into consideration is really identifying those key team members that are going to help you with this process. The goal with in-office clear aligners is to have a totally assistant self-driven aligner practice. However, as the doctor, you should be able to identify all of the key steps and be able to step in at any moment, either for training new team members or for taking over and assisting with the laboratory process for any difficult cases. However, as we go through the additional steps today, you'll see how these can be something that can be delegated to trained team members and can really engage them and add something new and fun into your practice. So let's take a look at utilizing Blue Sky Plan and how we can utilize Blue Sky Plan to create the design for our in-office clear aligners. Now, there are lots of software options available for in-office clear aligners. However, I really hope to share with you today the strength of Blue Sky Plan. One of the things that we have to look at with our clear aligner software is the usability and the functionality of it. Some softwares are scanner specific. Many require a subscription model. Some have limitations of whether they can print hollow or if they can only print solid models, if they can print vertically or horizontally, and if there are any automated steps in the treatment planning process. And today I hope to share with you the real advantages of Blue Sky Plan in all of these different steps. I've also written an article comparing and contrasting many of the software options for in-office clear aligners. And from this article, you'll also see the true advantages of Blue Sky Plan. I don't have time to go through all of the details today. However, the full-length article is available for free on my website under the articles on learndentistry.com. So if you want a little more information in really seeing the versatility of Blue Sky Plan, please check out the full-length article. When we take a look at utilizing Blue Sky Bio software and Blue Sky Plan, really looking at some of the key advantages, what I really like is that the Blue Sky Plan software is free to play with. I can create a setup for a patient. I can create a case. I can do a case presentation for the patient. And if they decide that they are not ready to move forward at that time, I'm not charged for having utilized the software. What I really like about Blue Sky Plan is that I'm not charged until I actually export the case. So for me, Blue Sky Plan has a tremendous communication advantage for patients, because if you have somebody who's maybe unsure about starting clear aligner treatment, you can quickly and easily create a visual treatment plan for them that they can see, and you can communicate with the patient. However, you don't have any financial costs involved in utilizing the software just for planning and creating. You're only charged when you export the files and that patient is ready to begin treatment. So really something truly unique with Blue Sky Plan, that you can utilize the software for free up until exporting. The exports are also very low cost. They are the lowest cost that I have personally seen in clear aligner software. And this is a huge advantage for us being able to have a really competitive price point for patients when we're trying to really compete with the direct-to-consumer movement and lowering our laboratory expenses. Blue Sky Plan can utilize any open STL files that you've taken on an intraoral scanner, where you can export them as an open STL. It's not scanner specific, so that's a huge advantage. And it really has very easy manipulation of individual tooth movement to create beautiful setups quickly and efficiently. Blue Sky Plan also has an automated segmentation process. It also has an automated and customized attachments. There are attachments that are programmed within the software that you can select per tooth, and then you can customize the location and the size of them on the tooth. And there's quite a nice attachment library. The numbers and the patient's names and a unique label can be placed on each of the models. And you can select whether you want to have open models that are hollow or a closed solid model. You can also print both vertically and horizontally. And we'll go over some of these in the demonstrations of the software. If there's one thing that clear aligners really depend on in the fabrication of in-office clear aligners or use of any aligner laboratory, is really starting with a high quality intraoral scan. This is what's going to set you up for success with your in-office clear aligners. And I like to touch on this because often many of the things that we encounter as difficulties, either with the treatment setup or with the fit of the aligner, are not related to the design of the aligners and the software, but they are actually a direct result of the quality of the intraoral scan. So when we're evaluating our intraoral scans, we want to see that they are free of any voids. Make sure to dry the teeth so that there is no saliva on them so that you get a clear scan of the interproximal areas. And when possible, you want to always capture 3 to 5 millimeters below the gingival margin. And the reason you want to capture the area below the gingival margin is because in the aligner software, when the base is added, if we do not have a sufficient amount of area that we've scanned below the gingival margin, the software will add a base that is often larger than what the gingival area would have been. And this is where you end up with aligners that stick out off the gum tissue or look like they're thinning out, that are flaring out away from the soft tissues. And that's because enough area was not captured below the gingival margin. So always trying to capture 3 to 5 millimeters. So let's take a look at some of the different features of the Blue Sky Bio software. I've created a series of videos that really highlight the strengths and advantages in Blue Sky Plan. And we can take a look and see how robust and versatile the Blue Sky Plan software is with designing our in-office clear aligners. One of the critical steps for in-office clear aligners is model segmentation. This is something that truly sets apart Blue Sky Plan with the ease and versatility of segmenting the individual teeth to create our model with individual movable teeth. I'm going to play the video for you so you can see all of the advantages. And please bear in mind that these videos are at about double the speed because I don't think you'd want to sit and watch me click through every single tooth in real time. So let's take a look at model segmentation within the Blue Sky Plan software. When we utilize the Blue Sky Plan software, there are modules for both aligners and for indirect bonding. We can import our patients' models and their cone beam scans. As we import our models, we're going to import both arches, selecting the maxilla and the mandible, and they will be brought in occlusion. You can always adjust the occlusion if you do not feel that it's accurate. Once we've imported the models, we're going to begin with the segmentation process. And following the panel on the right side of the screen, we're going to be asked to designate the mesial and distal of each tooth. This is going to define the boundaries of each tooth for the software to then calculate to determine where the gingival margins of the teeth are. We're also going to notate any areas where there is a missing tooth. going through the process in each arch. It is quick and easy to define these points, and it leads to a beautiful final segmentation process. We are going to add the base. As you can see, the base that was added there was quite large, but if I go to the preferences and settings, I can reduce the size of the base easily. I'll continue the process in the lower arch, defining the mesial and distal point of each tooth, placing a base on the model. And then we can see that the software will define where the gingival margins are. If we need to make any adjustments to these areas, it can be done very quickly and easily. And we can see how quickly we're able to segment the models. We're also able to define a trim line if you do have a mill in your office as an option for the automated trimming. And after just defining those key areas, we now have our model that is ready for individual tooth movement. So really looking at the strength of the segmentation process and how quickly and easily we can segment a model, this is one of the factors that really sets Blue Sky apart. When we can quickly and easily segment a model, having to define a minimum number of points, this cuts down on the time that it takes for us to create our clear aligner setup. Once we have our model created, we're really going to be ready for the true magic as we look at how to create the treatment plan setup for the patient. In this video, I'm going to show how easily the tooth movements can be manipulated using the three-dimensional gyroscope or movement widget to move and define the teeth's position. So here we can see the model that I have just segmented. And by clicking on and selecting a tooth, the movement orb or widget has appeared. And we can see here that this can move the teeth in all planes of space. We can grab either the circular portions or the arrow portions to move in the defined movement. It's helpful to manipulate the models so you can see them in all dimensions. And here, because this patient was concerned with the upper midline diastema, the first thing that I did was close the midline diastema to establish the midline that I wanted. And then I'm going to jump down to the lower arch. I can move the model in all planes of space so that I can see the direction and movement of the teeth, and then utilize the arrows or the orbs to manipulate the tooth position. The numbers that you see that are appearing there are showing the collisions between the teeth, and this would show the amount of interproximal reduction that would be needed. My personal preference is to establish the midline and then always go down to the lower arch so that I set up the lower arch first and then set the occlusion in the upper arch. However, you have the option that you can manipulate the two arches simultaneously, or you can select either the maxilla or the mandible to begin with tooth movement. We can see there when I turn on the IPR function, it shows me the amount of collision and the amount of recommended IPR. And there we can see the lower incisors in their final position and the amount of collisions and recommended interproximal reduction that the software has calculated. We can then utilize tooth movement if we want to reduce these values, and we will see them correct and adjust in real time. I find this function is really helpful when I'm working with patients that are very opposed to having interproximal reduction of the teeth. I can turn on the collisions and interproximal reduction features so that I can see how to minimize this as I'm creating the treatment plan setup. The Blue Sky Plan software also includes grid options. You can place a grid in any of the 3 planes of space defined as the X, Y, and Z grids within the software. And these can be utilized to help evaluate symmetry of the teeth and leveling of incisal edges. So a very strong feature in the software when setting up and checking the aesthetics. We can then go to our attachment library and we can select the attachments either in small, medium, or large sizes, and then manipulate them in position and size individually on the teeth. We also have the capability to add buttons. I like to treatment plan when I'm going to utilize elastics, and I like to treatment plan utilizing the buttons function within the software. And you can see how quickly and easily we can manipulate the attachments on the teeth. Once we have created our final setup and we're pleased with the treatment setup, we can then export the models. Exporting the models is a very quick and easy step, and we will export them per arch. This is helpful if you have a patient that has more aligners in one arch than the other. You can export the models individually. We also have different functions available for printing either horizontal or vertical, and that is selected in this step as well. You can see here for your 3D printing preferences, a base can be added for vertical printing, and it can also be separated into 2 individual bases for saving resins as well. We're able to select a name for the patient models, and that can be placed with the step number on the individual models, either embossed or engraved into the models, so that these will be easy to identify in the laboratory. When we're ready to export, the software is just going to confirm if we've added a platform, if we want to print vertically. Printing vertically is a big advantage that we can utilize when we need to print a large volume of aligner models. By printing vertically, we can really utilize that build platform. I like to print overnight and to print a large number of models. After exporting, we can also create our case report. This is something that I like to save in the patient chart. It shows all of the tooth movements and individual tooth movements and shows any areas necessary for interproximal reduction. I always like to have that ready and available when I'm seeing the patient chairside. So I save that into my practice management software. After exporting our models, I always check and review the models, and then they're ready to go to my 3D printer. I can see here that I've exported both my maxillary and mandibular models and my patient's case report. I can then open and see a preview of the model. And we can see that I've printed with a base for vertical printing. In addition to the base that we can add, you can also request an offset of the model on the base to improve the quality of the 3D printing according to your philosophies and your preferences in 3D printing as well. At this point, the models are ready to go to my 3D printer. And at that point, we'll continue with the fabrication of the clear aligners. One additional area of the software that I would like to share with you is the software preferences options. One of the unique features of the Blue Sky Plan software is how many different options we have available and how many preferences can be set. There are excellent default options already selected within the software. However, you can customize these to your preferences so that you do not have to reset them for each case. This can be done by going to Tools and selecting Preferences and Orthodontics. We can see here that we can choose the model height. This is what I was looking at in the first video, where we can minimize the height of the models to save resins when printing. If we have the options for utilizing a mill within our practice, we can also set some of the preferences for trimming using the milling system. And there's a great video online on Blue Sky Plan's YouTube channel to see how to set your trimming preferences. We can see with the clear aligners where we can set the trim margins, and we can set any preferences for the model platform heights as well. We can set limitations for our tooth movements. And we have the ability to set how frequently we want to be changing our aligners to manipulate the limitations for the tooth movement as well. And those can be saved in the Preferences tab for all of your cases. However, if you want to change those for any individual case, it's quick and easy to do. So let's take a look at how to implement in-office clear aligners into our practice. For me, a lot of it begins with the patient experience. My background before going to dental school, I actually worked for Disneyland. So I'm all about the patient experience. And a lot of it is having the communication in place with our patients and having the tools in place in our office to communicate with them the need for clear aligner treatment, either to correct a malocclusion or to aid restorative treatment, but also having a lot of the visual examples and communication tools. So, welcome to my practice. In my office, I have lots of brochures available on clear aligners. You can customize these for your office or utilize some of those that are commercially available. And in my practice, we have what I like to think of as a seamless visit for clear aligners. The patient comes in and they're given the information. We take their cone beam and I step into the operatory to take my intraoral scan. This is something that I could easily delegate to my assistant. However, my patients expect to see me at every visit. So I like to take my intraoral scan, really checking to make sure that I have the qualities that I'm looking for when I'm setting up my patient's case in the software, capturing the 3 to 5 millimeters below the gingival margin with no missing areas or blebs in the scan. My assistant will then take over and she'll take all of the intraoral photos for me. And she'll go through all of the patient education, utilizing some commercially available models that I have in my practice. You can always create custom models for your office as well. And the patient leaves with their next appointment to return quickly for the delivery of their in-office clear aligners. One of the things that I recommend with implementation is really leveraging technology and showing the patient the treatment simulation. This is really going to give the patients the wow factor when you decide to incorporate this into your office. And this is one of the strong advantages mentioned before with the Blue Sky Plan software, is that you're not charged to utilize the software to create a treatment setup. So if you have a patient that's unsure about moving forward, you can create the treatment setup and share it with them. Then after they've had that wow factor and they've committed to treatment, you can then export the models, and that's the point at which you're charged for them. So really, with patients that are unsure, encourage them to take that intraoral scan and then to return to your office in a day or two to see a treatment setup so that they've gone home, they've been able to get excited about the thought of clear aligners, and then they come back and they see the treatment that you've created for them. When implementing in your office, make sure you're showing off what you're doing. Highlight this within your practice. In my office, we have a flat screen monitor, and we show off our technology with our 3D printers, our before and after cases, and these create great conversation points with the patients So maybe they're there for a hygiene visit. Maybe they're there for a restoration, and they ask about the 3D printer you have, and you let them know, I create my own clear aligners in my practice. We could always take care of that small space that you have in the upper arch. Really showing off your work within your practice lets you open the conversation with more patients, and really opens the conversation with a patient who maybe has been thinking of clear aligners for years. They just never asked about them. So implementing a flat screen or models or photos on the walls can be very helpful. One of the other things that I've done is really creating my own brand. So I like to put my name on everything that I can within my practice, not just the toothbrushes. We have retainer cases, we have pens, I have custom bags and branding for all of my clear liners. Anything that comes out of our in-office laboratory goes in our customized bags that we have. This is a great way to be creative and for patients to know that you have customized this just for them. And really highlighting that personalization. I know many patients come in and they ask for clear aligners by name. So one of the major aligner manufacturers has done an excellent job of branding their name so that when patients come in, they only ask for that aligner company. And the first thing I say to patients is, well, do you want those aligners, or would you like me to make you custom made aligners utilizing my 3D printers in the back, and I can have them ready and customized just for you? I have to say that I have never had a patient ask me to utilize an aligner laboratory over my own customized aligners. They often are just referring to name brands because that's what they've seen advertised on TV. And highlight what you're doing in your practice. Show off your custom design. Show the patients a 3D printed model. If I print 3D models and do a case presentation for my patients, I let them take them home so that they show them to their friends, their family members, their coworkers. Really show off and highlight that technology. But what's really critical is your patient selection. When you first begin in-office clear aligners, you want to set yourself up for success by finding cases that you'll be able to create the treatment setup for and design the aligners and have a highly accurate result with by choosing cases that are maybe more appropriate for a first in-office aligner case versus a very complex case, maybe a 4x extraction case. That's maybe not the first case to try for in-office clear aligners. So I always say choose a slam dunk. Choose something simple. Choose a great patient that you know is going to be compliant so that you're able to really evaluate the in-office clear aligner process, not necessarily evaluating the process of complex treatment or a difficult patient initially. And I like to keep in mind, especially for all of the doctors that are in restorative practice, clear aligner patients are hiding in your practices. You just need to find them. And the number one way that I recommend doing this is by utilizing your team, enlisting your hygienist. I'm actually jealous of all of my colleagues that are general dentists that have hygienists within their practices, because I look at every single one of those caries and checks and wellness exams that you do annually as an opportunity to do a clear aligner consultation as well. So really get your hygienist on board with understanding the benefits of clear aligners and seeing how this is something that can open a conversation point with patients. I recommend asking at the initial exam if patients are pleased with their teeth or if they are interested in having any alignment of the teeth done. When we're looking at identifying those cases that are good initial cases for in-office clear aligners, again, I recommend choosing something fairly simple, not a very complex case when you're implementing something new. Once you're familiar with the workflow for in-office clear aligners, then treat those really complex cases. So I recommend looking for minor anterior spacing, minor anterior crowding. Look for minor orthodontic relapse. How many times do we see a patient that comes in with a fixed retainer and they have no idea that it's broken and they don't know why their teeth are moving? Or those patients that have a fixed retainer on the lower and their lower teeth look great, but you see relapse in the upper? Ask them where their upper Holly or upper Essex retainer is. Odds are they can't remember the last time they wore it. These are fantastic patients that have been through orthodontic treatment before, probably with bracket and wire orthodontics, that would like to correct the relapse, but they're not willing to go back into brackets and wires again. These are great patients to identify for in-office clear aligners. And also looking at any single arch treatment with limited goals. Maybe a patient that has a midline diastema that they would like closed, or a patient that has a minor rotation of 1 or 2 teeth, and that's all that they want to accomplish with treatment. Those are good cases to get started with because the patient has a defined goal in their mind of what they're looking for in their clear aligner treatment. When we look at identifying those good initial cases, again, minor anterior crowding or spacing, minor orthodontic relapse and lost retainers, and single arch treatment. Also critical and key is that we identify a patient that is going to be a good candidate themselves, somebody who is going to be compliant with 22-hour per day wear, looking for minor tooth movements, that they're in good oral health, and that they have realistic expectations of their treatment. Whenever I implement something new, I want to make sure that I'm doing it on a patient that will be extremely compliant so that if treatment does go off track, I'm able to more easily identify, was it patient compliance or was it just a simple complication with the treatment that we just need a refinement or a revision? Some of the good cases to look for after you've had more experience with in-office clear aligners are any of the moderate anterior crowding or spacing, correction of moderate overbite or overjet, and any class 2 or class 3 corrections. The cases that I definitely recommend avoiding are any patients with active periodontal disease, patients with missing teeth, as this makes it more complex for fitting the aligners and designing the aligners, any difficult tooth movements or large movements, short clinical crowns or dental anomalies like peg laterals, dental implants and bridges, any patients with severe parafunction or a large centric occlusion centric relation discrepancy, and any severe class 2 or class 3 cases, or any patients that are having active TMD or active TMJ pain. So let's look at the advantages of utilizing Blue Sky Plan. As I mentioned, there is a very low export fee per case. And in the Blue Sky Bio and Blue Sky Plan model, you're able to purchase exports in different quantities. We can see here the minimum starts with 10 ortho case exports. And when you purchase 10, you get 2 additional exports for free for $125. This breaks down to just under $11 per case if you're purchasing the minimum. However, if you're purchasing 1,000 exports, you can bring this down to $5.70 per case. When we look at an ortho case, that is defined as both upper and lower arches. However, if you only export 1 arch, you are only charged half of an export credit. So if you want to export 1 arch and begin treatment and then the other, you're only charged for the amount that you're exporting. And for those doctors that are familiar with Blue Sky Bio and utilizing exports for the surgical guides, an ortho export is approximately half of a surgical guide export. So we can see here the tremendous cost savings when comparing Blue Sky Plan to other aligner softwares. This by far is the lowest pricing structure I have seen for any clear aligner software. Combining this with the robust nature of the software, it's a win-win. What I like to share with you is the cost breakdown in my office if I was looking at a 12-step case. So if I have a patient that needs 12 steps for treatment, I would be creating 24 aligners, 12 for the upper arch and 12 for the lower arch. And if I was to begin by purchasing just the minimum number of exports, I would be looking at just under $11 to export my case. If I look at the cost of 3D printing my models, now I do own 4 3D printers. So I looked at the cost breakdown on this based on my Formlabs and my model resin, looking at an average size model. So the typical cost is going to be approximately $2 to $4 with that particular printer in my office. So if I estimated $275 times the 24 models, I would be looking at $66 in model cost. And then for vacuum forming materials, there is quite a range. However, my preference is to utilize the 3-layer aligner materials that are available on the market. And those are typically around $4 per sheet, bringing us to $96 in fees for the vacuum forming materials. So we can see my total materials cost is $172.42. Now, this does not involve the cost of the 3D printer, the time to create the setup, or the cost of trimming the aligners. However, this gives us a rough idea of strictly our materials cost. Now, I know in my office, I do have a laboratory technician, and I do have several assistants that are trained to trim aligners. And I know how much they're paid per hour and how many aligners they can trim in an hour. So I can easily calculate from there in a case what my cost would be when I'm calculating and setting a treatment fee for a patient. And I know for many of us that are on this webinar today, many of us already own or utilize a 3D printer for other things within our practice. So this is really just expanding the use of equipment that we already own. So one of the things that I like to really look at with utilizing this technology in my office is how do I really set my practice apart? There's a lot of competition within the orthodontic space. And for me, this is something that has truly set my practice apart. The fact that I can have clear aligners ready for my patients the same day or next day. Also, it creates for patients the value in my practice that things have been custom made for them. When we look a little bit further, when we look at the benefits of utilizing Blue Sky Plan in office aligners, there have been other things that I have identified over time that have become a tremendous value to my office. This has really engaged my team in the process. We can see here trimming aligners with some of my team members and 3D printing. I have to say this is what really kept a lot of my team working during the COVID-19 shutdown. We normally manufacture our clear aligners in small batches. However, I had team members come in and we completed entire cases for patients so that they would have time in the laboratory when we weren't able to see patients, but they were able to create their clear aligners for them, giving them some hours and time in the office so that they were able to stay engaged and stay working. This really allows me to control my laboratory fees, and this allows me to compete with the direct-to-consumer pricing. By having lowered my laboratory fees overall, I can lower my fees for treatment and treat more patients. This also allows me to bring my quality control in-house for my clear aligners and allows me to exceed the patient's expectations, both with customization and with the time frame to receive their clear aligners. I've also been able to take ultimate and complete control of my aligner design. I'm able to do same-day starts, control my laboratory fabrication process, and give the patients the true wow factor. So there are many benefits. Also, I've been able to identify and really brand my office specifically for its technology and its customization. So there have been quite a few benefits of incorporating this technology and this workflow into my office today. I hope this webinar has helped you to see how you can incorporate this great technology and utilize Blue Sky Plan within your practice as well. If you're looking for more instruction after today if you would like more formal courses on how to utilize the software, diagnosis and treatment planning, or any of the laboratory processes from start to finish. I would like to again offer you $50 off on my online course utilizing the coupon code BSB Web 2021. I'm going to take questions today, but please make sure that you connect with me on Facebook or Instagram or in my in-office clear aligners form so that I can answer questions after today. The only thing that I request is please do not call my private practice, as it does confuse my team when doctors are calling for me. So please connect with me online, Facebook or Instagram.
Melissa, thank you so much for that presentation. I loved a lot of the tips and comments that you had regarding the customer experience. I didn't know you worked at Disney. Very interesting piece of information. But the tips are fantastic in my opinion. Thank you.
Oh, absolutely. Let's go ahead and let's take some questions today. Sorry, we're running a few minutes late, but I definitely want to make sure to answer all of your questions. We have a question from David about where should the points be placed in the premolar region for segmentation, on the cusps or on the mesial-distal. I like to place them on the mesial and distal of the marginal ridges. I find that this gives the most accurate segmentation for me. So in the incisors, I go a little more towards the incisal edge, marking the mesial and distal of each tooth. So, and you'll see with the segmentation process how easy that is when you get in and work with the Blue Sky Bio software. I would honestly recommend downloading the software today if you haven't utilized it, and taking just any intraoral scan that you have and just practice segmenting it. So if you need to, scan yourself. And to be honest, that's how I test a lot of things. I actually use my own intraoral scans, and then we'll just play with them in the software, or we'll actually make a set of retainers for myself. So there is a question here from Stephen about can movements be done in stages? Like the easy movements first, or expansion first and then rotations. There is not a way to section out the movements within the software, but the great workaround for this that I recommend is to select the movements that you want. Maybe you want to do expansion first with a patient, and to do just the expansion, and to export the models and to complete expansion with the patient, and then take a new scan and do more or less a revision or a refinement for the rest of the movements. Especially if you're treating a lot of adults, expansion isn't always as predictable as we would like with adults, just because of their lack of growth. And this is a really good workaround to work on those difficult movements or those easy movements first, and then to see which movements you want to do second. So you can stage it just by which movements you complete in the software and which aligners you fabricate.
Can I jump in and add a couple of comments?
Sure, absolutely, please.
Okay, so to combine that question with the next question about least movement first and least movement last. So there is a drop down in the software where you're able to select if you want the least movement, the teeth that move the least, to move at the beginning of the process, or to have them move at the end of the process. So there's a simple drop down, and you're able to select which technique you would like the software to sequence the teeth in, and then you could check the movement in each one. Regarding the question about prioritizing teeth movement, so we do have the ability in the software to lock particular teeth so that they don't move at particular stages. We also have the ability to hold particular teeth at particular stages. And we also do have the ability to define a milestone for a particular tooth at a particular stage, meaning to make sure that a tooth is in a particular position at a particular step. So we do have some built-in functionality that makes the sequencing and tooth movement more customizable for different situations.
Excellent. Um, thank you so much for those tips and tricks. I find sometimes I find my own little workarounds, but definitely the more you delve into the software, particularly using a lock on a tooth, that is a great way to establish different steps. Um, question from Giovanni on adding attachments. And how do you know when to add the attachments? That is something that comes with time and experience. However, I always recommend them for large tooth movements. Philosophy on attachments is something that I could actually talk about for probably an hour. One of the things that I really stress as well is a lot of tooth movement depends on aligner design as well. So sometimes we find that we can just avoid attachments if we're utilizing a very good pressure forming machine, and if we are trimming the aligners down below the gingival margin and we're getting enough retention on the teeth. So my preference is typically to use as few attachments as possible because patients don't like the feel of them. And sometimes they can actually interfere with the seating of the tray. However, I will use them for very large movements. But attachments is a whole webinar in and of itself. So I would recommend doing a little bit of research on aligner design and fabrication and seeing how you can, really utilize the use of the aligner and the materials that you're using to minimize your attachments.
We're actually testing a version of the software now that's available in the Facebook group with automatic attachment placement. So just as a side comment, that will simplify for a lot of users who might not be sure about when and how to place those attachments. We're testing a version of the software that's available in the Facebook group now where the attachments are placed automatically.
Excellent. That's one of the exciting features that I'm really excited for when it comes out in the final version. But definitely go to the Blue Sky Bio users group and check the software out there for sure. Okay, I am asked about 3D printers on here. SprintRay versus Formlabs. Definitely a webinar in and of itself. Lengthy question. I will direct you to my Learn Dentistry website. I have an 8-minute video on there and an entire article on selecting a printer for in-office clear aligners. So a lot of selecting a 3D printer, in my opinion, most of the 3D printers that are utilized are capable of printing for clear aligners. It depends on the other things you want to print in your office. If you want to print surgical guides, if you want to print occlusal guards, that's something to consider, the other resins that you want to print. So for me, SprintRay and Formlabs are both great printers. I own several of each, to be honest, just because of the demands of our laboratory. But definitely check out the video. It really depends on the other things that you want to print. However, I can say that both are highly accurate for printing for in-office clear aligners. Let's see. Question here was, where was the best place to learn about attachments? I do talk about this extensively in my course. However, I recommend looking up the literature that was written by James Ma at the University of Las Vegas, Nevada. He's done some outstanding research on the use and placement of attachments. If you need the direct references, you can send me a message and I'll get you the information on those articles. but those are probably the best articles that have been written on attachments, in my opinion. Somebody asked why do I have 4 printers? I actually own 14, and that's because I practice with a prosthodontist who just keeps buying them and has a large demand to print a broad range of resins. Which 3D printer do I use on a day-to-day basis? The one that he's not using. So I think that'll shed some light on how versatile and how many printers you can use. I know there are some outstanding printing options available through Blue Sky Bio. If you're interested in automated trimming, I know that there are mill options available through Blue Sky Bio as well. So that's something that I would reach out to Michael here after the webinar and have him kind of point you in those directions, because a lot of times the natural progression is to print, and at first you're vacuum forming and trimming. And then if you're doing a lot of cases, you're going to want to go to automated trimming with milling. So you may want to look at one ecosystem that all works together. So if you're considering going down that road, then that's something that I would reach out to Michael on. So I was asked here, what vacuum forming machine do I recommend? I recommend any of the pressure forming machines. So I myself have a Mini Star, but any of the pressure forming machines are what you want to look at. The old style vacuum forms where you have to pull down the sheet of plastic do not have, they don't have as good of contour and adaptation to the models. So I would look at anything that is pressure forming. So lots of questions on here. I'm going to see, I think we have time for 1 or 2 more. So here's a question on how do I determine how often a patient will change their aligners? I determine how often the patient changes their aligners based on their compliance. If I feel they're going to be really compliant with treatment, I'll reduce the time. What I typically do is start my patients. If they're an adult patient, definitely not growing, the first set of aligners I give them, I'll have them wear for 2 weeks and make sure that it's fully tracking, fully seating. Then I will go down to 10-day wear gradually, and then I'll try to go to 1 week wear. So a lot of times it's figuring out how compliant the patient is, because if they're not particularly compliant, they're going to have to wear the aligner longer. So you can do that starting with a larger amount of time and then reducing down time. The other thing that I utilize in my practice is a lot of remote monitoring with dental monitoring. So it's an app that the patient downloads on their phone. They take scans of their teeth. I'll have my patients take a scan once a week. And if the aligners are fitting really well, we'll continue at 1 week wear, or even in some of my teens, we're able to reduce that down. So if the patient is on board with utilizing remote monitoring, it lets us really customize the wear schedule for the patient.
Do you want to choose one final question?
Sure. I'm looking for one that particularly pertains to the software. So here is a doctor who is asking about button size of the buttons coming out too small. Any recommendations? When you're selecting your buttons or your attachments in the software, there are the options for the small, medium, and large, and then you can manipulate it on the model. If you're having trouble with them coming out too small, I would recommend checking a larger size or enlarging them. that's not something that I have run into. One of the options here, I'm also wondering if this is that they're coming out small when you're bonding them. And that could be because there's some type of void in the process of bonding them onto the teeth. So I would make sure that the material that you're using for your attachment template is either something that the material doesn't, that the composite won't bond to, or put a real light coat of Vaseline into the attachment well and then wipe it out almost completely using a gauze so that it's a layer that's so thin that you can't see it, to make sure that you're bonding. But by utilizing the different size attachments or buttons within the software, I think you should be able to find the size that you need.
Okay, so thank you so much for this presentation. Fantastic presentation. We have a lot of comments coming in from the chat box as well, thanking you for the presentation. So thank you for the time and for all the education that you provide to the dental community. A few final comments, technical issues. We'll be sending out the CE credits via email within around a week. So check out your email for those. As Melissa mentioned, labpronto.com is a great resource. If you need help either with the planning or the manufacturing, you could get that help and assistance at labpronto.com. We have additional education available on blueskyplan.com. We have free training videos and tutorials, both clinical and software related. So please check that out, as well as our Facebook group. Search for Blue Sky Bio User Group. That's a fantastic free resource as well. Please check our upcoming webinar schedule, blueskyplan.com/webinars 2021. I'd like to thank everybody for taking your Sunday morning and participating in our educational webinar. And Melissa, thank you once again for your presentation.
You're very welcome. Thank you so much. I'm sorry we didn't have a chance to get to every question. If you do want to reach out to me at Aligner B, I'm happy to answer them there.
Okay, thank you everybody. Have
Perfect.
a great day.
Thanks so much.